Oftentimes women are dismissed. Their pain is dismissed, their symptoms, their signs, everything about them is dismissed. Hello everyone, welcome back to the channel. I hope that you are all doing well. In continuation of this theme of Fibroid Awareness Month, I want to talk to you about the top signs that you might have fibroids. Now, take this with precaution because there are lots of health conditions that can look like what I'm about to talk about. Some of you might have an inkling that you have fibroids because number one, you may have had fibroids in the past, and maybe they've, reappeared or they've come back again, they haven't really gone away, or maybe, for example, you have a family history of fibroids in which your mother, your sister, your grandmother or aunt may have had fibroids, or you know that you're eating something that has been shown through evidence-based medicine to lead to an increase in fibroid number or size. So what I'm going to tell you, again, take it with precaution, but also know that there are things that you can do for yourself today in which I want you to do. So the first thing I want you to do is when you are considering whether or not you have fibroids and you're going through these signs and symptoms is number one, always keep a track of a daily log or of a diary of your symptoms. Heavy menstrual bleeding is an indicator that fibroids might be present. Pelvic pain might be an indicator, for example, bloating or distension. And I'm not talking about after you eat, but like a consistent pattern. And the American Colleges of Obstetrician or the American College of Obstetrician and Gynecology has talked about this. Evidence-based medicine and research guidelines have talked about this, as well as the NIH. They talk about these things and what to look out for. Now, in addition to keeping your log, it might sound weird, why am I keeping a log of my pains and symptoms? Well, the reason is you want to use this information and track this information so that when you go to talk to your physician or your nurse, you come with your evidence. Oftentimes women are dismissed. Their pain is dismissed, their symptoms, their signs, everything about them is dismissed. They're told that it's all in their head. And that should never, ever, ever be the case. Now, also consider taking vitamin D and, paying attention to things that might imbalance your hormones, causing high hormone levels, for example. That's going to be important for you to do. And then if the time comes, getting an ultrasound or an MRI might be warranted. That's why I want you to advocate for yourself and just consider all these options when I'm talking to you about the signs and symptoms of fibroids. So let's dive into these top signs of fibroids. Now, the first sign I want to talk to you about is heavy menstrual bleeding. Some of you might be thinking, well, that's very subjective. Every woman bleeds differently on her menstrual cycle, and you are absolutely correct. But think about how many pads or tampons do you need to go through on your menstrual cycle? Is it so many throughout the day? Some of you like to change your pads and tampons just because it's more hygienic for you or it's more comfortable for you, etc., etc. But if you are changing your pad and your tampons frequently, so many times because you're just soaking through your pads and your tampons or your underwear, that's heavy menstrual bleeding. There is a flow to your menstrual cycle, of course, but again, you want to consider how many times you have to change. If if you are soaking through clothes and underwear and all of those things, frequently, you need to be cautious. You need to pay attention to those things. And additionally, if you are having heavy bleeding for more than 7 days. Again, like I said, there is a flow, a normal menstrual cycle or a normal period in which your lining of the uterus sheds itself is between 5 to 7 days. If you're going beyond those 7 days, then you need to take a look at it, take an extra look at it, talk to your provider about why this may be happening, because there's a hormonal imbalance. Typically you have and I'll show a picture graph here, you have peaks and valleys, an ebb and flow of your menstrual cycle, of your hormones, progesterone and estrogen throughout your menstrual cycle. But when you have such an hormonal imbalance that is causing heavy bleeding, that's when you want to look into it. Now, the second sign of fibroids that you want to pay attention to is having infertility issues. If you have been trying to conceive for a long time and you have not seen a provider, you might want to check that out because it might be the cause of your infertility or fertility issues. It's a hormonal imbalance, so there might be something going on with you with respect to that. Also, miscarriage can occur. It can be a sign, and complications during pregnancy. So these are things you want to look out for. The third sign that I want to talk to you about is pelvic pain, or that abdominal pain and fullness in your lower abdomen. These are things you're going to want to pay attention to, especially if it's something that's not caused by exercise or diet or something that you ate. Having that consistent pelvic pain, you need to look into that a little bit more. Just don't chalk it up as, oh, it'll go away when it keeps coming back. Please do yourself a favor and do your due diligence and get it checked out. Now, the fourth top sign of fibroids that I want to talk to you about is frequent urination. Fibroids can actually press against the bladder, making you feel like you have to urinate frequently. Now, the fifth sign that I want to talk to you about is constipation and bloating. Pressure on the rectum can lead to GI symptoms. You might look pregnant when, number one, you're not pregnant, or number two, you've already delivered your baby or babies, so why are you still looking pregnant? So this is something that you might want to look into. Could it be fibroids? Is your abdomen or your uterus hard? You can feel if your abdomen is hard. Your uterus is a little bit more difficult, but you could take a look in the mirror and do yourself a self-evaluation about whether you're having this type of distension in your abdomen. The sixth sign that you might have fibroids includes painful sex or dyspareunia. Now, the seventh sign of fibroids that is commonly seen in women is lower back pain, and this is because fibroids tend to press on organs around your lower spine, around your lower area in your abdomen. So you just want to consider that if this low back pain is caused by fibroids, or is it caused by something else. Some of you might not have slept well, you might be exercising too much, you might be having poor posture. So again, yes, there are other things that can contribute to low back pain, but do yourself a favor and monitor your health so that you can try and get a better understanding of, is this a consistent back pain? Could it be triggered by fibroids, or is there something else going on? So just keep that in mind. And 8 is similar to constipation and bloating, is the abdomen distension where you look pregnant. Now, this is probably considered the same thing, but again, consider your abdomen distension caused by food or not caused by food. It's kind of repetitious here, but it's something that I marked specifically in addition to constipation, because they're two different things. Constipation and bloating can be quite different and look different than abdomen distension in women. So I hope that this information in the video has been very beneficial for you. Do yourself a favor and start tracking your symptoms and advocate for yourself, and make sure you are implementing habits that are going to be beneficial for you, even if it includes vitamin D, changing up your dietary habits, seeking out advice from your provider, and making sure that you are on top of your yearly annual physicals, as well as getting your lab work so that you can test for your vitamin D levels. Not all physicians are going to call for hormonal level tests, but you never know. You might be able to get some hormones tested if you are within a particular stage of your menstrual cycle where you can be able to test for that. So I do hope, again, this video has been very beneficial for you and helpful for you. Let me know in the comments what questions you have. I thank you for watching, and I shall see you in the next video. Take care. Bye.